This pain scale is used inappropriately by so many nurses, so I thought we could talk about how we actually use this pain scale. And I did this video a long while back. People were all up in a tizzy about this, like, how do people not know this? But there are a lot of people that don't know this, and we're not here to judge. We're here to learn and educate and grow. So let me cover it. This is the Wong-Baker Faces Pain Scale, and it is used in patients who are not able to maybe verbally tell you, like, hey, I'm a 6 out of 10 pain, and they're having a harder time communicating their pain. However, they could point to a Faces Pain Scale and tell you, like, which one they feel like. So how it's meant to be used is you're supposed to show your patient all of these faces and say, which one do you feel like? And in the perfect world, your patient would point to which one represents them. How it's not meant to be used is as a subjective pain scale by the nurses. So for example, oh, my patient looks like they're a 10 out of 10 pain. I'm going to score them a 10 on the Faces Pain Scale. That is meant for a completely different pain scale that we could talk about if you guys like. But for the Faces Pain Scale, it is supposed to be presented to your patient and allow them to pick which one they feel like. I hope that clarifies things, and please be nice in the comments, okay? People tend to judge a little too hard around here.